Bronchiolitis. Overview. 1. Inflammation of bronchioles with edema and excess accumulation of mucus, air trapping and atelectasis result from increased airway resistance because of small obstructed bronchioles. 2. A major cause of hospitalization of high-risk infants. 3. Respiratory syncytial virus, RSV, is primary causative organism, which is spread by contact with respiratory secretions and contaminated objects. RSV is not airborne but can live for several hours on non-porous surfaces. 4. RSV bronchiolitis is most prevalent during first 2 years, most occurrences in spring and winter. Bronchiolitis usually begins with a mild URI. As disease progresses, gas exchange is compromised, hypoxemia results, and metabolic acidosis develops. 5. Useful preventive measures are breastfeeding, avoiding exposure to cigarette smoke, hand hygiene, and for high-risk infants, monthly intramuscular injection of monoclonal antibody palivizumab from November through March. B. Assessment. 1. Initial clinical manifestations include sneezing, coughing, rhinorrhea, eye drainage, intermittent fever, and possible wheezing. 2. Progressive symptoms with worsening infection include tachypnea, retractions, anorexia, thick nasal secretions, and increasingly labored breathing. Older infants may have a frequent, dry cough. 3. Auscultation of lungs reveals wheezing or crackles. 4. Nasopharyngeal washing to obtain respiratory secretions identifies causative virus. Chest X-ray may be normal or indicate hyperinflation or nonspecific inflammation. C. Collaborative management. 1. Assess respiratory status hourly, provide humidified O2 to ease respiratory effort, use pulse oximetry to assess O2 saturation. 2. Clear nasal passages with bulb syringe, elevate head of bed. 3. Cluster nursing care to allow for rest, assess anxiety level of parents and provide support, maintain a calm environment. 4. For fluids may be needed if oral intake is compromised, monitor strict INO, weigh daily to assess fluid loss. 5. Maintain strict hand hygiene and contact precautions. Caregivers should not care for other high-risk children. 6. Medications. Possible ribavirin via inhalation, bronchodilators and corticosteroids are sometimes used. D. Child and family education. 1. Disease process and provide support to lessen anxiety. 2. Assist in care of infant, explain all procedures and treatments. 3. Use bulb syringe as needed to keep nasal passages clear. 4. Frequent oral fluids. 5. Notify healthcare provider if child refuses to eat or breathing becomes worse. 6. Humidifier in child's bedroom. 7. Avoid smoking in child's vicinity. 8. Practice strict hand hygiene and keep child away from individuals with upper respiratory infections. RSV can reoccur.